often take our health for granted, assuming it will always be there, until it is gone. Everything else loses meaning, and all focus turns to regaining health.
Mimi nikiwa mmoja wa wachakale, mimi niko na afya yangu ni banki yangu ya kesho ama ya kesho kutwa. Bila afya hatuwezi ishi, sababu ndiposa binadamu aishi lazima akuwe na afya njema.
Serving the majority of the 50 million Kenyans, our public health supply chain bears a brand of this responsibility, including the immense logistics that go into providing drugs and health-related products to the country's entire public healthcare system. This monumental task is a mandate of the Kenya Medical Supplies Authority, Kemsa. Established under the Kemsa Act of 2013, Kemsa's mandate is deceptively simple.
Our mandate is to procure, warehouse and distribute. So it is very important that we get all the parameters right.
In reality, this responsibility is a sum of many continuously moving parts which must work in harmony at all times to efficiently serve patients up to the farthest reaches of the nation.
The remarkable thing about Kemsa is that the drugs or commodities go direct to the facility. Which facility? Whichever. Which location? Wherever it is.
Kemsa is expected to play a significant role in delivering Kenya's public health aspirations under the Kenya Health Plan 2014-2030.
We are able to get the best quality products at very affordable rate. So it's something we want to leverage on. We have economies of scale, and this is something that we are going to build on in the new strategic plan.
Now on the second strategic plan for 2019-2024, which builds upon the successes of the previous one, Kemsa is continuously reviewing how best to play its part. A key component of Kemsa's mandate is to utilize economies of scale in procurement to bring down the cost of health products and technologies, HPTs, thereby lowering the cost of healthcare. This way, Kemsa will play its part in actualizing universal healthcare, UHC, under the Big Four agenda.
UHC is the solution, really, to delivering healthcare to the majority of Kenyans who up to now don't have insurance.
If you don't prioritize the procurement of healthcare supplies, then UHC will not work. And therefore, a good working engagement with Kemsa is very important to ensure that that works.
The achievement of this mandate depends on partnership and coordination with the Ministry of Health, county governments, and other strategic partners. With all levels of health facilities well stocked, including the smallest dispensaries, patients no longer have to travel long distances to access health services.
We've developed a system like a downward referral system. It has really helped patients, avoid the cost of coming to a hospital monthly just for refill.
This success story has been made possible in part thanks to the county government's initiative in developing new and upgrading health existing facilities taken over from the national government post-devolution.
We have revamped most of our health facilities, and in the same period of time we have been able to operationalize a number of new health centers.
Kemsa's role is to support these initiatives by availing reliable, affordable, and quality health products and technologies. The existence of Kemsa revolves around delivering quality healthcare at the right price in a timely manner. Kemsa is by a big margin the biggest and the supplier of choice to the public health system.
What has helped all of us is to have Kemsa deliver all the commodities direct to that facility. Doesn't matter how far it is.
It takes a very short time to place the orders, and from the time we place the orders with Kemsa, we get a fill rate, that is the number of drugs supplied, up to 90% of our requirements.
Our procurement department has recently migrated to the Integrated Financial Management Information System, IFMIS, which is expected to enhance controls and accountability.
His Excellency the President on 31st August directed that Kemsa must go online in procurement for transparency amongst all those other things. And we agreed at that moment that IFMIS as a platform was the best way to go.
We have a robust quality assurance system that ensures inspection of products upon receipt from suppliers, both local and international. This includes a return and replace policy for non-conforming deliveries to our customers.
Once you have quality items, you expect the price to be a bit higher. So affordability, if we per quality, I would say they're affordable, a good quality.
Their commodities are worth the money we spend on them. Quality, and they've also been fairly timely in the delivery of those commodities.
The reason why products are barcoded, we use the barcodes to trace and track inventory in the warehouse. The barcodes have the expiry date, the barcodes have the quantity, the barcodes have the product type, the barcodes have also the source of funding for each and every item.
To serve the nation, Kemsa has built a wide national distribution network. The main logistics center in Nairobi consists of 2 warehouses, including the latest and modern Embakasi Logistics Center, the largest of its kind in East and Central Africa. This investment will improve Kemsa's capacity to satisfy growing demand for HPTs now and in the coming years.
That's our pride and joy. It is our Vision 2030 project, and it's going to be the premier healthcare facility in East and Central Africa, something we are very proud of. It's about 15,000 square feet. We are going to centralize all our operations. It will run from there. It will be very modern, and we are going to use very modern features, including the end-to-end supply chain visibility from there, to be able to serve not only Kenya, but with time, the East Africa region.
The Embakasi Logistics Center is supported by regional distribution centers in Kisumu and Mombasa, as well as depots spread out in various parts of the country.
This center covers an average of 19 counties. That is averagely half of the Republic of Kenya. And these 19 counties, we have a population of about 20 million customers.
This network ensures faster delivery of healthcare needs, reducing turnaround time for orders, because at Kemsa, we recognize that lives often depend on speed.
Considering that proximity between Kisumu and Kericho, I believe we will be able to get our commodities faster.
Evidently, it is a complex undertaking that is subject to challenges, and success cannot be achieved without coordination with county governments.
Kemsa has a very wide network of medical stores. Since it's a government agency, it is very easy to do business with Kemsa. The process of procurement is much easier.
In a joint resolution, county governments decided to ring-fence their healthcare budgets, underscoring the importance of the health portfolio in county government planning, which also impacts our planning as a main supplier of HPTs.
Every effort is being made to ensure that we meet the expectations of all health facilities, both at the county and the national level.
We strive to bring healthcare as close to the patient as possible, sometimes in places requiring the support of security personnel.
Barabara mbaya, alafu hiyo side ya Modogas ndo security si mzuri sana.
Our footprint can be found everywhere in the country, in every nook and cranny. Wherever healthcare products are needed, we get them there.
In Homa Bay County, we have islands. We have very hard to reach, like Mfangano, Takawiri, all these are hard to reach. But Kemsa is able to deliver commodities to them.
Kemsa has been serving us for a very long time. They have always been our main source of consumables.
Demand for healthcare services has increased in tandem with population growth, requiring innovative thinking to solve problems. To keep track of the thousands of products, Kemsa has invested in the development of a customized software called the Logistics Management Information System, LMIS.
Once a facility is able to access internet, they're able to put their orders into the system, and wherever I'm seated, even at the county level, I'm able to work on it.
The software has reduced costs related to paperwork and improved efficiency in logistics, minimizing delivery errors and product returns.
It's accurate, and because it's an electronic system, it's also really fast.
The data from the LMIS has proved very useful in mapping out product requirements for different regions, a crucial role in optimizing accurate and targeted supplies to all the 47 counties. For example, the data has pointed to cancer as a non-communicable disease with a growing prevalence in eastern counties, enabling us to plan adequately while expanding our product portfolio.
We have been doing mass sensitization of our community, talk to our people, explain them about NCDs, and then do mass screening.
Communicable diseases such as HIV, AIDS, malaria, and tuberculosis are a special focus of our surveillance. This focus has borne fruit in the control of the spread of infections. Provision of quality drugs and proper patient management has resulted in lower mortality rates, and many patients are leading normal, productive lives.
We receive all the commodities for ART, and then the peripheral facilities make their orders on a monthly basis on what they consume from here.
We're now having a total of 143 active clients who are coming here on a monthly basis to get their drugs, and the drugs have never run out of stock.
Kwa hii nyumba yangu niko free, hata watoto wangu wananga wakopa juu wanajua hiyo ndio maisha yangu. Wanatoa tu, mama ndio hii dawa yako meza.
The fact that drugs for communicable and neglected tropical diseases, NTDs, are either free or heavily subsidized can be attributed to critical partners and donors for whose support we are grateful. Our disease burden mapping has also identified counties that are afflicted by neglected tropical diseases, NTDs, such as visceral leishmaniasis or Kala-Azar, elephantiasis, trachoma, and envenomation by snake bites.
Were it not for Kemsa and partners, the treatment will be out of reach for most, if not all of the residents of TRT.
On average, treatment for NTDs is very expensive. NTDs are lethal diseases that are fatal without treatment. They also require immediate medical intervention, especially envenomation by snake bites.
Roughly in a month, approximately 15 patients in a month. So we find it's quite a number of patients. And the treatment we use around is Inosap.
Fortunately, Kemsa has been very proactive in procuring and availing the best antivenom.
At any given time, a health facility which serves a region which has reported snake bites has at least some few doses of antivenom, and we are able to redistribute whenever we have shortages.
Stunting is another health challenge that is common in certain regions arising from malnutrition.
Come 2014, we did the Kenya Demographic Health Survey, and in that we found out the stunting rates for Kilifi was at 39.1%. Actually, we were number 3 nationwide.
With the support of donors such as UNICEF and USAID, we have intervened with nutritional supplements, in the process improving the health of thousands of children.
There are several packages of interventions through partnership. All this partnership was to make sure that we have timely commodity distribution for the malnourished children in the wards or outpatient.
As for maternal and child health, MCH, the children, who are the future of the nation, are not able to speak for themselves, but their mothers do so eloquently.
Huyu mtoto alikuwa na shinda, lakini nafikiri Monday ndio nilikuwa huko General. Dawa zenye nilipata akakunywa na akapona.
We remain faithful to our 3 core guidelines of quality, supported by a robust quality assurance regimen, affordability, supported by a vigorous procurement process, and accessibility in response to the last mile aspiration. The success of the Kemsa mandate requires close consultation and collaboration with all stakeholders. Eldoret GK Prison is among Kemsa's target clients of the Supplementary Services Division SSD, whose mandate is to offer specialized products and services to public health facilities. Operating in such a dynamic environment where parameters can change radically, such as political, economic, social, technological, ecological, and legal, Kemsa needs to always look ahead and plan for the unknown. Challenges notwithstanding, Kenyans are in dire need of quality healthcare every day, and this remains our focus.
Kemsa is doing a great job in terms of taking care of our commodities, because every time we do has commodities from Kemsa, we are getting them.
Our engagement in Kemsa has been quite very warm customer care relationship.
A healthy nation is key to the achievement of all other development agendas. In collaboration with other stakeholders and partners, Kemsa is determined to contribute in delivering a healthy nation. Each one of the 50 million Kenyans deserves quality and affordable health products and technologies, and that is our ultimate goal. Kemsa, your partner in healthcare.